Can a psychological approach actually heal your chronic pain and symptoms? Hi everyone, welcome back to another video. I just spent the last 8 days filming, and we're filming our online course that's going to be available in a couple months. We just need to edit it up, which I'm excited to talk about because it's going to include 10 comprehensive modules to support you in healing your chronic pain and symptoms. Now, our topic today, can a psychological approach actually heal your chronic pain and symptoms? Are you skeptical? I get it. When I was healing, I was super skeptical. And I was a therapist. And so I knew there was a connection between trauma, between being in a survival state and chronic pain and symptoms developing. But I was really skeptical in believing it. And the reason I came up with this topic today is I got this comment. I believe it was on Instagram. And it was basically, well, it was a little bit harsh, but they were telling me to take my psychological babble and stuff it down my throat because they didn't think that their chronic pain had anything to do with emotions, with trauma, with their state of their nervous system. And I'm not angry at the comments. I actually get it. It's unfortunate because our society has led us to believe that medical treatments are the only treatments that are going to help your chronic pain and symptoms. And don't get me wrong, I love the medical model. There's a lot of benefit to it. When we acutely injure ourselves or we get a virus or some type of disease taking place, it's really helpful. But for a lot of chronic pain and symptoms, it's not. And so we know that a psychological approach that focuses on treating the brain and nervous system is really effective in healing chronic pain and symptoms. Personally, if you're new to this channel, I had debilitating chronic pain, pretty widespread, and some other odd symptoms as well that were chronic. And no matter what I did every test, I did every assessment, I met with specialists, I did medications and treatments, and it just wasn't getting better. And using a psychological approach that focused on treating the brain and nervous system, I was able to fully heal. Now, I have my story on this channel. I'll link it to the top here if you're interested in watching that. But I'm a big believer in this. But it's not just my personal story. I share lots about that because I know lots of people want to know about that. And I hope it gives you hope. But the other thing is that we have research. We have research data showing that often chronic pain and symptoms are not just a physical issue. And a lot of times they're more of a brain and nervous system issue. We understand that a lot of chronic pain and symptoms are what we call neuroplastic, meaning that your body is actually completely healthy. What's taking place is your brain starts to misinterpret things. So safe signals are going up from your body. They are. Safe signals are going up, but the brain is misinterpreting them as dangerous. And the reason it's doing that is because your nervous system is stuck in the survival state. And when we're stuck in a state of survival, chronic pain and symptoms are just a common symptom of that. We need to come to understand that and believe that. And you don't have to fully believe it at first. Maybe you're listening to this video and you're like, I don't believe any of this, and that's okay. When I first started, I remember when I was reading Sarno's book, I threw it across the room, ranted to my partner about it because I thought it was complete BS. But by starting to be open to this approach and understand that, hey, I was living in a state of survival since I was a child. And it just escalated to a point where my brain and nervous system started to produce chronic pain and symptoms. And so it's understanding that, but we also have research showing us that, pain reprocessing therapy, emotional awareness and expression therapy, different types of somatic therapies actually can help us reduce or eliminate our chronic pain and symptoms. And that's a beautiful thing because that's what started to sell me on it. I remember reading Dr. Schubiner's book and being sold because he explained it in this scientific way. And as that comment said, it wasn't just psychobabble. It wasn't just psychological babble. Like there was real evidence to support, hey, a lot of chronic pain and symptoms are neuroplastic, and there's effective treatments to actually have them reduce or become eliminated. And so that's why I made this channel. That's why I'm making this course. I want to support people in actually healing because I know how such a beautiful thing it is. And so if you're skeptical, that's okay. But some things to consider. If you're considering, should I start to utilize a psychological approach to treat my chronic pain and symptoms? The first thing to understand is, have you had lots of tests? I always recommend people get tested by doctors, specialists. I'm not opposed to that. I think that that's a really important aspect. But have they not been able to find anything? Or you're given diagnoses like fibromyalgia, where there really isn't a cause. It's just explaining you have widespread pain. Same thing goes for like chronic fatigue syndrome. And with all those tests and scans and assessments that you've done, have they been having a hard time explaining your physical symptoms and why they're there? That's the first clue. Or they're having a hard time fully explaining. Like maybe they're finding some issues in terms of like your spine, but the amount of pain you're in doesn't make sense. This is a common thing doctors will say. That's a good sign that, hey, you should use this mind-body approach. The second thing is when your chronic pain or symptoms came on, was there a stressful or emotional event taking place at the time? Even positive ones. For myself, I was changing my major in school. I was getting ready to marry Anne. These were positive things, but they raised the level of danger in my brain and nervous system. The second is, did your pain or symptoms come on suddenly? Or even if you did injure yourself, are you long past the typical time of healing? Our body is beautiful at healing. It's designed to do that. So if you're 3 or 6 months past, the typical time of healing, then it's probably time to utilize a mind-body approach. The next thing to consider here is, have you tried lots of physical treatments and they haven't been effective? What this means is that you're trying to treat a brain and nervous system issue by treating the physical body, and that's never going to work. So if you've done so many different treatments and you're not seeing progress, it may be time to shift to a psychological approach and focus on the brain and nervous system. So these are all factors to consider when you're wondering, like, should I try this approach or not? It's okay to be skeptical, but you want to gather some of the evidence. Like, are your pain or symptoms inconsistent? Sometimes they're there, sometimes they're not. The intensity level's all over the place. For myself, sometimes I go for a walk. My pain would be a 2 out of 10 in my back. Other times it'd be an 8 out of 10. Inconsistency is a good sign that your symptom is not behaving the way, a physical issue does. So look for inconsistency. Look for moving or spreading. Is it spreading and ping-ponging all around? If you don't have a systemic disorder, that's how neuroplastic pain and symptoms behave. Things like multiple symptoms. I'd have a whole video explaining every single symptom that I had. It was a widespread all over the place. And so I had so many symptoms and there wasn't a systemic issue that was found. And that's how neuroplastic pain functions. Because of fear, because of dysregulations, it just spreads like wildfire over time. Other things to look for is, are your pain or symptoms symmetrical, like both sides of the body? Especially with pain, this is really peculiar. What's the chances you manage to damage both wrists in the exact same way? Or both shoulders? For myself, I had shoulder pain, both sides. And I came up with all sorts of explanations of why I was on both sides. But that's a really good piece of evidence, especially for pain, that it's more of a brain and nervous system issue. So these are just some of the factors, but it's also wondering about, emotions. If you have difficult emotions, if you have stress, do your pain or symptoms increase rapidly? Because that's also a sign it's neuroplastic. Again, pain is rarely just a physical issue. We're not built as human beings like that. Brain, nervous system, body, it is all interconnected. Unfortunately, our society just believes that pain is this physical issue. If you have pain or symptoms, there's something wrong with the body. That's it. The brain and nervous system are almost not included in that equation. which truly, when you think about it, is quite silly, because as a human being, every system in your body is interconnected. And your brain and nervous system, they run the show. Pain is always produced by the brain, whether there's something physically wrong with your body or whether it's because of a state of survival, it's always produced by the brain. And it's always real. I know I'm going on another rant here. Pain is always real. Regardless of if it's physical or if it's a brain and nervous system, it doesn't matter. Pain is always real. I think that's something that holds people back, is they think that if their pain is a brain or nervous system issue, they're like, it's all in my head. I must be faking it. That's not the case. It's just our pain can be generated in different ways. Especially physical symptoms, same thing goes, like chronic fatigue, chronic dizziness, tinnitus. And so gathering some of this evidence is really important. Other things that I look for when I'm treating someone is, are you in a constant state of survival? Fight, flight, freeze, or shutdown? If that's taking place, your pain, even if there is something physical, is going to be amplified twofold or more. When we're in a state of survival, everything becomes amplified. Sounds, right? Like even sensory issues like sight and light, it's amplified. It can feel really overwhelming, and physical sensations are amplified as well. The other thing to look for is coping mechanisms, perfectionism, people-pleasing, excessive conscientiousness. These are things that could mean, hey, I should try a psychological approach. So does this psychological approach work? Yes, it does for a lot of people. I've seen it with myself, I've seen it with the clients I work with, and we know this from the research. And so I made this video for anyone who's considering, should I dive into this? If you're saying yes to any of the things I've talked about today, it may be it's time to shift your approach. Now again, I want to say it's always important that you get checked out by doctors first. You want to be responsible for your health. But after you've explored that avenue, it might be time to shift gears. So again, I have lots of content on my channel. Please check it out. Dive into it. It's all on here for free. And comment if you have questions. I'm happy to ask questions. I can't diagnose you with neuroplastic pain. I'm a therapist, so I'm not in the business of diagnosing people. But when I work with people, I look for what's the likeliness. What's the likeliness that this is taking place? Now over social media, again, I can't diagnose you because I don't know your case fully, but I'm happy to answer some questions or some wonderings you've had, because I want to support people in understanding that this approach can work. It does for hundreds of people, and it may work for you if you start to become more open to it. So I've filmed for a lot for the last 8 days, so this is just a brief video. Again, my course will come out. I did it with a few of my colleagues, my partner, Anne. If you haven't checked out our podcast, go check that out. There's lots of content on there. The links are below. And I also did it with Alex Klassen, who's another therapist at the clinic. So, thank you all for listening. Take care.